Oh, Joel, hi, how are you doing? Hello, I thank you for those who have tuned in as we give the rest the next 2 minutes to join. I'll just like to ask either of you if maybe if I'm audible enough. You can also, as you respond, you can also test if you're audible. So, am I? Can you hear me?
Yes, I can hear you personally.
Ivy, can you hear me, please?
Yes, I can hear you loud and clear.
Yeah, thanks. All right. I thank you everyone for making time to be um, here today and to take part in this. I really value that, and I don't take it for granted because you've spared your time. I just want to confirm if everybody can hear me. If Ivy had already said she could hear me, Joel, I hope you can hear me too. If you can you hear me?
Yeah, I can hear you. I can hear you.
Okay, and I hope also box girls, you can also hear me.
Yes, we can.
Okay, thank you so much. All right. So as I was just saying, I appreciate each one of you for taking their time to be available into this space this evening. Just to talk about the main issue that the key issue. And just as an introduction, I'm Joshua. I'm the program manager for Raise My Hope Community Project. And so as part of the exercise, or as part of the campaign that was adopted by the National AIDS Council and National Commission for Population Development, that is the campaign that is dubbed the Ending Triple Threat campaign, a campaign that is um, pillared on three things, that is to combat HIV infection, and also sexual and gender-based violence, and also to combat adolescent and teenage pregnancies as being the key pillars of the Ending Triple Threat campaign. And I would just like to tell us that having this conversation today is one of let me call it the episode one, because being my guests today, I would just inviting you, or I'll just request your indulgence. The first discussion we are having today on the cases of rising cases of teenage pregnancies and contraceptive use is one of the pillar issue under the Ending Triple Threat campaign. And then the next conversation we are going to have over the same, I'll share invites for the same. We are supposed to have 3 episodes, and I beg for your indulgence over the same 3 episodes. This first one will be talking about the rising cases of teenage pregnancies and contraceptive use with the same panelists. And then the second time, we are going to have 2 weeks from today, we are going to have this another conversation on SGBV, sexual gender-based violence, as one of the pillar issue under the Ending Triple Threat campaign. And then the next conversation will be having the HIV infection combatants as one of the pillar issue under the Ending Triple Threat campaign. At the end of the 3 episodes, we are going to, each of us, we are going to have a certificate of appreciation for the same from the National AIDS Council and from Raise My Hope Community Project as an organization. So I feel much privileged, and I hope you. So I will just request each one of us for the presentation over the same, because the space is on record. At least I will ask us. At least I know each of us, but now maybe somebody is from Box Girls Kenya. Maybe you introduce yourself, then Effie you'll be next, then Ivy, then Monica Marvel, then we'll just start up, please, kindly. So the representative from Box Girls, could you please introduce yourself kindly?
Hi, everyone. So, thank you, Joshua. My name is Stephanie.
Stephanie Kish from Box Girls Kenya. I am the communications officer, and I'm really, really excited to join the space.
Thank you so much. Effie, you're next.
Hi, I'm Effie Yunan. I'm an innovator and I'm also an advocate for women's rights. Uh, and I'm very grateful to be in this space today.
Thank you. Ivy.
Hello, everyone. My name is Ivy Songok. I'm a student pursuing journalism, and I'm also an advocate for leadership and also children. And I'm glad to be here.
Thank you so much. Joel, please, if you can hear me. Okay. Thank you. Thank you, guys. So as we start up this, I think most of my speakers have introduced themselves. Um, so with all said and done, I think I just gotten a request from Joel. He's connecting to introduce himself. I think he's having an issue. So I think 3 days ago or 4 days ago, I shared the guiding questions for the space conversation. And be it being a listener or being a speaker of today, the floor is open to everybody. And in the case where you want to lay out a point or to add on what a speaker has said, you just request to speak and you'll be granted the opportunity to do so. So let me take this opportunity to welcome you all to this space. Just as I've said, I'm Joshua Wenslaus. I'm program manager, Raise My Hope Community Project. And just as I've said, I've requested for your indulgence in the next 3 episodes. The next 2 episodes, this is the first episode, the next 2 episodes that we'll be having on the core issues of the Ending Triple Threat campaign. And so I hope as we get on, we'll talk over the same. So as we start, there were guiding questions that I'd shared regarding the same. And from my point of view, these ones are reviews from the community we work with, and also some are from the media. And there are many media stations in the country have brought into the limelight the issue of teenage pregnancies within slums and teenage pregnancy post COVID-19. So I'll just take this opportunity to go to the first issue, um, the first question for the space. I'll pose the question to the speakers, and I'll choose one of the speakers to expound on the same. Each of the speaker will have 3 minutes to expound on a question, on an issue, and then as we go on, and even the listeners, if you have something to add on what a speaker has said, you can request to speak. So the first guiding question to the space with regards to what we want to discuss now, because we are talking about the rising cases of teenage pregnancy, and we have to begin from somewhere. So what could be the contributing factor to increasing teenage pregnancies, or like what could be the stimulator to increasing teenage pregnancy? What is making it so unique that 10 years down the line or 5 years down the line, the cases of teenage pregnancy were not so high as we can articulate to now? So what could be some of the contributing factors to teenage pregnancies? And I will give Ivy, you have the floor. The next 2 to 3 minutes to give your say over the same, and then Effie will be next, and then Box Girls you'll be next, and any other person who will want to speak over the same. So, Ivy, the floor is yours. What will be the contributing factor to increasing teenage pregnancies on your own view?
Thank you so much, Joshua, for the chance. And something that I'd like to say first is that 1 in 5 adolescents aged 15 to 19 are already mothers or pregnant with their first child in Kenya, that is. So, according to a research that was done in 2021. So, basically, the main issues that lead to these teenage pregnancies, the first thing is sexual violence. You find that it is increasing at a fast rate, and you find that kids are violated by close relatives or even in schools or by people they people in their communities. So since these issues go unaddressed, then they end up contributing to higher pregnancies. Another thing is limited parental guidance. So in the past, we used to have a lot of information coming from parents, guidance, do not do this. But nowadays, you find that parents are more laid back in the current time, leaving it to teachers. So you find the kids are more on their own, like doing their own stuff. And this has really led to a high number of teenage pregnancies. Another major factor also is marginalization and poverty. So in this case, you find that teenagers opt to engage in premature sex in order to get maybe food, some money. So you find they have, like, there's some case of where teenagers are engaging with border guys, to get some food, to get some money. And this is very rampant, especially in the areas where we call slums. So this also accounts for a high number of teenage pregnancies. Another thing is inadequate access to services tailored for young people. You find like places like VCT centers where youths can be educated. They're mainly run by old people. So youths are scared to go there for advice. But if places or hospitals were tailored to meet the needs of the youth, they could go there for advice so that they can be able to know what they should do and what not to do. So this would be really better. So those are the main factors according to me. Another thing before I forget also is lack of education or dropping out. You find that the teenagers who drop out of school, since they have nothing to do, they end up getting pregnant at that time because there's a large window of time where they're out of school. So that's also a factor.
Okay, thank you so much, Ivy, for that presentation. Effie, could you? The floor is yours over the same question or the same issue.
Okay, thank you so much, Joshua. On the question, there are a few more things that haven't been highlighted. Things like social media in this generation. I believe we live in an age where all kinds of information are accessible either by phone or by computers or laptops. So this makes it actually harder for parents to give the proper guidance, because a child can go into social media and access anything, any kind of information, any kind of content. And this tends to spoil some teenagers because they get exposed to content that is not appropriate for their age, content that they are not sure they should be emulating. Some of this content can actually make the teenagers to start emulating the things they are seeing being done there. So this can actually increase the rate of teenage pregnancy, because some teenagers don't know when to stop. As an adult, you can see some content and you can actually stop yourself from imitating them. But for teenagers, it's different because they don't know which information to consume and which information to ignore. So they haven't been taught that. And on that point, not many teenagers know what they're supposed to be following on social media, who they're supposed to be looking at, the people they're supposed to look up to, and the people they're not supposed to look up to. So it's not something that society has trained them to do from an early age. So they don't know what to emulate and what not to emulate. This can cause teenage pregnancy. And apart from that, there's also peer pressure because a lot of teenagers when they don't know how to listen to their inner voice in many situations. They actually flow with the crowd. So this also tends to lead to teenage pregnancy because a lot of them want to be like every other person. And apart from that, there's also social constructs and culture where where people have been trading sex for money or some that kind of thing for ages. And when a teenager grows up, they think of that as what they are supposed to be doing. No one actually tells them that, by the way, this is wrong. They It gets to a point where they can actually be included in these harmful practices, but they don't know that what they're doing is wrong. Things like early marriages, things like uh, things like inappropriate sexual relations, because they don't actually realize that these things are wrong. So the goal as parents and caregivers as a society should be to actually teach these teenagers these things so that they know them because before these things actually happen to them. Yeah.
Thank you so much for that presentation. And now, Box Girls Kenya, you're next. The floor is yours to give us your thought over the same issue.
Yeah, thanks so much, Joshua. So I've just realized speaking last means speaking least because everyone has spoken. So since Ivy and Effie have mentioned the major things, I think I'll just speak on two things that they haven't mentioned. One is policy. So we are really lacking policy that will really guide us to prevent such cases, because when you look at these things, you realize that we don't have a strict structure on the perpetrators. You find that this teenage pregnancy, most of them, the fathers are old people. Like you might find maybe a 16-year-old has been impregnated with a 24-year-old or even a 30-year-old and all that. So that really means there is no a clear policy that will guide us to show that once you have sex with a minor, you have to be taken some strict measures. So that's one thing that is lacking. And even the policies that are in place have not really been implemented. So there's still a gap on policy. Another thing is poverty. So I think poverty is one thing that is really increasing the high rise in teenage pregnancy, because you might find that these girls are really coming from poor backgrounds. They have to stay back home because they don't have school fees. So now that they are home, what else do they think of? They think of making friends and having some conversation with men so that maybe they might have money so that they can go back to school. So poverty is also a factor that has really been ignored, and it's really major. Yeah, so I'd say policy and poverty. Thanks.
Okay. Thank you so much. Just as I had said, if we have any other person who is not a speaker but a listener who has an issue to raise or an issue to add over the same, just request to speak, and I'll give you an opportunity to add on something. Uh, okay. To the next thing. We have that one we were discussing about the contributing, what could be the contributing factor to increasing teenage pregnancies, and just an highlight of what have been said. I think Joel, you can add on that maybe if you have something maybe.
Hello, sorry for my delay. My network had got some problem. Now back to
Just be more loud,
now.
please.
Oh, sorry, my I had got some issue of net, but it's sorted right now. On the topic above, my main points will be based on lack of parental guidance, as has been mentioned earlier. Like when we look even in the Bible, when authors were writing the Bible, there is somewhere in the verse in the book of Proverbs 22 verse 6, whereby parents are told to train up their children in the way they should go, so that even after they are old, they won't depart from it. Actually, it emphasizes that even if they are older, they won't depart from it. To mean even the older generation, those who are older, are being looked from a point of view that they may be culprit of the same, because there is this issue of wababa emerging on social media and on the streets currently that is a major contributor to this.
A major contributor to
The bigger issue that we are
the
talking
bigger
about.
issue that we are talking about. Hello, Joel.
Hello,
We
Joel.
can't
We
hear
can't hear you.
you clearly.
Somebody just clicked on his mic and that brought some interference. Sorry.
Okay,
Yeah.
okay.
The next point I would like to mention is lack of information. We've seen that most of the teens lack information to make informed and responsible decisions about when and where to have sex and the consequences thereafter. You find that this headache, like access to information, has been limited to an extent that even what is vital for a growing child, they can't access, and that is so sad of us. The next point that had been mentioned though earlier is peer pressure. This ranges from drug abuse to unprotected sex. From my book entitled "Still Thirsty," I wrote of something heavily known as youth screenshot. Find that youth currently, they want to balance between maximum positivity and maximum negativity. This makes them to flows and want to be like others, and there without putting into measures what it takes to be like those whom they want to emulate. And this has made them to, regardless of the means, ends justify. That is the key motto that they are using. So they'll want to go out, they'll want to do blah blah blah, and in exchange they'll offer themselves, their bodies, so that at least they be seen that they are somewhere. The next one is about sexual abuse. This is majorly known as rape. uh, this is the reason as to why, as an gender activist, we normally, during our normal campaigns, we normally advise that in case of rape, the lady or the girl in this case now should visit health facility within 72 hours. Regardless of the cause of this teenage pregnancy, please let's gear this campaign. Let's enlighten these people, the minors, on the dangers of this. From what I was doing, I actually made it clear that even those unresponsible people who are beyond 19 years and have made one or two people pregnant are to be categorized as teenagers, because the teenage pregnancy, the essence of it is lack of responsibility. That is what is making this thing a headache. Thank you.
Okay, thank you so much for your presentation. I saw somebody requesting to speak. That is Monica. The floor is yours. You have a minute to give your thoughts over the same. Marvel. Okay. Now those I think I don't have a big issue because people are sending requests and I approve the request and they're not speaking. So as a minute. Thank you so much. Okay, guys, thank you for your patience. That was just okay. Just you can just go on, please.
Joel speaking. So I hope I won't repeat whatever he said. So first, what I'll say is that we assume these girls are not having sex; they're not sexually active. And what I've realized from my interaction with them
from age 12, these girls are sexually active, especially because I'm working with the girls from rural areas. So information on contraceptives is needed, plus they should have access to those services. So parents and teachers from schools should understand that these girls are sexually active and this information is needed. Yeah, that is one. Two, I'll add on poverty. So first on poverty, there's that period poverty. So again, we assume maybe 50 shillings cannot make someone uh, do a transactional sex for a pad. So they lack these pads until they even use the vitamba. But then if it's to the extreme, they to get the pads, they have sex with these people. So there's that too, and it's on the rise and it's a crisis. I don't know how we'll help solve that. We also have these girls go for long distances to school, up to 4 to 5 kilometers. Someone walks for 5 kilometers to school. So then these riders, border riders, take advantage of that and offer free rides. And there's nothing like free ride, so it's free ride for sex. So that also leads to teenage pregnancy. And yeah, we also have uniform issues on uniform. They lack uniform. Maybe one when they join, they have one uniform. Now one is expected to go with that uniform up to Form 4. Uh so in for you to have maybe another one and the parent cannot buy it, how will you have it? The transactional sex. So for me is that transactional sex which is caused by poverty and lack of information on contraceptives and SRHR, because some don't even know about menstrual hygiene. So they get them from maybe friends who mislead them, and misleading them leads to that teenage pregnancy. Thank
Thank you so much for your presentation. Now we'll go to the next question on the topic. That is the question one was what could be the contributing factor to increasing teenage pregnancies rather, and at least we've had presentation and talks from different people and their side of view. Now the second thing is do parents and caregivers in this case, if you don't have a parent you have a guardian, that is a caregiver. So do parents and caregivers take part in advising adolescents and teenagers to go for abortion? Now here is a case where a teenager is already pregnant. The action has already taken place. Now we are looking at the solutions. The solution is either to keep the pregnancy and go back to school after delivering, or to get rid of the pregnancy. So do you, in your own views, do parents and caregivers take part in advising adolescents and teenagers to go for abortion? Or if yes, if you think it's yes, they take their time to advise them to go for abortion, or do you think it is a decision? You know, when I'm in a relationship with someone, a partner, a premature relationship, I will call it that, then I get pregnant. Now the act of the first question was on ways to avoid that. Now the action has already happened, so we are trying to look for solution. Now we are together in this. I did not get pregnant by air, so we are two people in this. And then there's a third party, the parents. You know, men don't speak to their parents about making ladies pregnant, but the lady has a guardian or a parent. At the end of the day, the belly will start coming out and people will see. So they have two choices, either to keep the pregnancy or to get rid of it. So do you think most of the ladies share this with their parents? And to what extent do you think the parents take time to maybe tell the lady go for abortion or not? Or do you think it's a decision whether to go for abortion or not that comes from the partner? If I have a teenage lady, I've made them pregnant, now mimi ndio namuamulia kile ambacho wanafanya. Do you think the parents have a say in this, or it's a mere decision of the two premature partners? And for that question, allow me to give opportunity to Steph and Effie. 2 minutes each to respond on that, please. So Steph, you'll go first. Box Girls Kenya.
Thank you. So for me, I'd say first, the biggest question is, do we really think as abortion is a crime? So for me, I'd say sometimes yes, a parent can step in, and I don't think there's an issue if a parent steps in to advise a child on the directives to take. The only problem will come in when the parent forces the girl to do an abortion when they really when the girl really wants to keep the baby. So my thoughts on that exactly is I'd say yes. Parents really take chances in advising their child, and I don't think there's an issue unless there's zero consent. So those are my thoughts.
Thank you so much. Effie, you have anything to add on if the parents taking part in decision making? Just a minute to air to give out your point, maybe.
On the issue about parents being the decision makers, I think it's subjective because in some cases the parents might actually know better, and the the teenager themselves may not actually know what is good for them, or maybe they know but they're just not willing to face the consequences. But on abortion, again on abortion, it's subjective. In Kenya, by law it's illegal to have an abortion unless it's going to save the life of the baby or the mother. So I believe that situations can be really different. It actually depends on each situation individually. Yeah.
Thank you so much for that. And let me give a minute to Ivy to give us her take on that, and Monica also a minute each to give us their take on, even do parents give consent, or do they help in decision making, or do these people just get into decision making by consulting their young partners? Please. So Ivy, you will go first.
Okay, so basically what happens is that when the lady finds out that she's pregnant, normally in early stages, they inform their premature partners. And from this, they come up with a decision whether to keep it or not. And mostly they'll decide to carry out an abortion. But for the cases where the pregnancy goes unnoticed and then it reaches later stages, that is when the parents realize. And so they just allow the kids to keep. So in most cases, the parents do not encourage the children to carry out an abortion. But the thing is, in Kenya, mostly what happens is that these premature partners, when they realize this has happened, they normally carry out an abortion on their own. That is what happens mostly. So it doesn't reach the parents.
Thank you so much. Marvel, a minute to maybe to add on whatever they're saying, if you have any.
Oh, okay. Thank you so much. Maybe I'll just say maybe the parents can just advise on if maybe they were close, because only close parents can really talk to these kids. So yeah, if they can only advise but not force. It's their body; they can make the choices themselves. About I don't know about the premature, the other partner making the decision. They're not supposed to. So I don't like. I can't commit further. Thank you.
Thank you so much for your for that. And now we'll go to issue number 3. Um, just for those who are joining now, the first issue we were talking about were the contributing factors to increasing teenage pregnancies, and the number 2, whether parents are being engaged in decision making with regards to abortion or not. And now the third issue is what are your thoughts on the case of abortion? Because we know in Kenya abortion is illegal, And so, what are your thoughts on abortion? Whether this a teenager has gotten pregnant, and now we want to there are parents who wants to preserve their image and their reputation. So, what are your thoughts on the case of abortion, and when is it regarded as being safe with the case of a teenager? And also, which are some of the hospital? This one I need ladies to talk on this. Which are some of the hospitals in Kenya that are licensed? Now that we know that abortion should be carried out in complicated situations where it threatens the life of the mother. But now, do we have licensed institutions that are supposed to offer abortion? Because people do abortion, and I always try to ask myself, if people do abortion, the other one now, the updated one where they go and take pills and all this stuff, do we have licensed hospitals to do that? And do they work with the policy, whether in consideration whether this person is a teenager, or is a past teenage, or is an adult past 18? And when is abortion regarded safe? Because I can, okay, we can do an abortion to a teenager, but at the end of the day, there may be costly consequences of not giving birth when she's already married or so, or maybe of a bleeding that can lead to death. So when is abortion regarded safe? Two, which are some of the hospitals that are licensed to perform abortion? It's not that we are trying to encourage this, but I think people are doing so many things illegally. So maybe, I think personally, I've had an experience with one of the girls we work with at the community center, and I personally, I think, mimi kwa mwale maoni yangu, I know there's this hospital called the one that says children by choice not by chance. I think it's nimesahau jina. But then, over the same issue, let me take the indulgence of because box girls work with girls, and also let me also take the indulgence of Joel to contribute over that a minute each of one, when is abortion regarded safe? And two, if by any chance you know any hospital that is licensed in Kenya to perform an abortion. Yet we know it is illegal unless on complicated situation. So, box girls, Kenya, the floor is yours. You have a minute to give us your thought over the same, please.
Thank you, Joshua. So for me, I'd say for abortion to be regarded as safe is only when the government has a policy that allows abortion to be legal. So in Kenya, we can't say really there's a safe abortion practice unless the case where a mom is in danger and they really have to save a mother. So as long as there are laws that are restricting safe illegal abortion, then every abortion practice is unsafe. So the only hospital we know of as an organization where we refer cases of SRHR, sexual, where we partner with sexual reproductive health and rights is Maristop. So I'd speak on Maristops because that's what I know.
Thank you so much. Joel, you have a minute to respond to that. Maybe if you have a response.
Yeah, thanks once more for the chance. Actually, based on all that have been mentioned, we see that all the stuffs that are used for abortion, they are safe, but the action itself isn't safe in accordance to the constitution, with the limitation that is, according to the to Kenyan Constitution 2010, Article 26, sub-article 4, I guess so. It is mentioned that in the opinion of authorized health officer, that is when there is need for emergency treatment, when the life of the mother is in danger or of the baby is in danger, that is when we can say abortion is safe constitutionally. Then onto the Lancers hospitals, as Box Girl has mentioned, the Maristops, Kenya. There is others that are inclusive of Family Health Option Kenya, Reproductive Health Network, and those are some of the few ones that have been enlisted. But then we need also to admit that there are some in other unlicensed institutions that are done chini ya maji, we call it so, of which is very wrong, because when it's authorized, then it's then when it is deemed to be much safe, because all the precautions have been put in place. Thank you.
Ivy, can I request for your indulgence over the same, please, in a minute?
Okay, so for me, what I think about abortion is that first, it is risky depending on the stage of the pregnancy, and it is only regarded as safe depending on the personnel who are carrying out the abortion. Remember that some ladies carry it out in, unknown places. Some quacks will trick you and you'll end up getting complications. So that is one thing to consider. Also, facilities, the place where you carried it out. Somewhere like Maristops, they are mainly known for that and they have like good facilities. And so some ladies may opt to do it elsewhere. So the facilities are very important. So when it is done by good personnel and with good facilities, then the abortion can be regarded as safe. And also the stage matters because how an 8-week pregnancy will be terminated is not the same way that a 3 months pregnancy will be terminated. It is very different. So that's where the safety comes in. So depending on the stages, you have to know the personnel to include and the facilities to visit to ensure that we safeguard these teenagers.
Thank you so much, Ivy, for that. Now, this is just like a question, and I need to know thing. Uh, I've had experiences, or I've had come to contact with people at the community center who now, at that case, they were HIV positive. They were kids in high school, Form 1 and Form 2. Now, because it was so much need at that point, this girl was suffering from leukemia. I think you know what leukemia is. So, bearing in mind that situation, she was suffering from lack of blood, and now even if you tell the lady, and the parents were saying like, even if she was to keep the pregnancy, she suffers from leukemia. So now we sorted the consent of the parents, and now this lady was taken to FHOK, Family Health Options Kenya, and she was given up. They went, and I personally, I used to know, I used to know abortion is done in a very, very complicated way. It involves using of surgical equipment and all the stuff, but currently I think the world is so much advanced. So the lady was given a pill, 2 pills, and she was given an instruction and told, ukifika kwa nyumba, take the pill, put it under your, it says under your what? Under your tongue, and then just wait. That is the first pill, and then the second, she was given 4 pills. So hiyo siku ya kwanza alikuwa meza hiyo moja, and then it was explained like it will start shedding off the walls of the uterine walls, and then the second, third, and fourth drugs will do the whole process. So even if we are talking about licensed institutions like Family Health Options Kenya or Maristops, it is a case of it's not inpatient. You don't lie at the hospital because they're going to do for you an abortion. There's nothing like surgical abortion of these days. These days you take pills, and these pills you buy them and you go consume them at your own, even if it's your mama's place or your own house. So in the case where there is an issue of a bleeding or so, how is it to be addressed? Because kama hospitali ilishakusikia ikakupatia dawa uende ukameze, na umeenda kule kwa nyumba ukameza dawa, na umekuwa na overbleeding ama vitu kama hizo, and some of these, let's say the Maristop branch in Kisumu where we are currently don't work for 24 hours, and there's no inpatient service to abortion. So how is this supposed to be addressed? I'll seek the indulgence of Effie and Marvel respectively. You just have 30 seconds to give an insight to the same. So the floor is yours, Effie.
Thank you. So, on the case of abortions, because recently there are no cases of surgical abortion, only medical abortion, I'd like to also highlight the fact that not everyone actually goes to the hospital. There are people who take things like jig, there are people who take things like daily, very concentrated juice. There are people who take things like tea to try and abort. And I'd like to say that it's usually a case of the blind leading the blind, because sometimes the people who actually recommend these things are not certified, or they are not professional in the advice they are giving. So in some cases, when someone goes for medical abortion, and maybe they've been sent home from the hospital with the drug, and they take it, and then things don't go the way they expected, sometimes it gets bad, and the society has to be involved. Maybe it was something that was being done in secret, but now that things have gone bad, the society has to get involved, and that's where the problem starts, because the society comes with stigma. Everyone tends to stigmatize the person who was trying to carry out the abortion. And also, when such a thing happens, the law also has to get involved, because abortion is actually illegal. So at that point, the law also has to have a say on the situation. And also, sometimes people die. We have seen a lot of our young ladies die because they didn't know the correct channels, or maybe they went for an abortion and things went wrong, because in such situations you can never ever predict what is going to happen. You can never be sure of the outcome. So people lose their child, or some people even become, they lose the ability to have children altogether. So a lot of teenagers don't know the consequences that are on the table when they actually get into abortion, and sometimes they do, because sometimes they know the consequences, but they're willing to face the consequences instead of facing what the society could do to them when it discovers that they're pregnant. So the main aim is to try and reduce this stigma, the stigma that faces teenagers when they get pregnant, and also the stigma that goes on when someone has aborted, because although it is illegal, people are still aborting. There are clinics out there. There are people who are doing it for through back end means. There are also people who just decide to do it themselves. So it's really causing a lot of damage, because people don't know the options that are on the table. A lot of teenagers are not told that you actually have an option of keeping the baby. You actually have other better options. Yeah, thank you.
Thank you so much for that. Effie, no, no, not Effie, Marvel, Monica. I just asked a certain question. Could you have any issue to add on it, please?
Okay, so hi again. So my opinion is currently abortion is illegal, and it's a topic that not everyone wants to talk about. And so many organizations are now coming out to advocate for safe abortion. And a lot of our no the health practitioners are supposed to be involved in most of these advocacy, so they can help in that when that complication happens, because when that girl overbleeds and she needs to go to the hospital, So she needs to be treated. So I'll just say there's more advocacy needs to be created, and these health practitioners are supposed to be involved so they can help people, these young girls, when there's complications. Don't kusikuwe na stigma and judgment. They just be helped. Thank you.
Thank you so much for that. Now here comes a very another I need to know thing. Now um in the case the next issue now the next issue I'll put it this way. Assume Ivy, you're a principal of a girls' school, or Effie, you're a principal of a girls' school, or Steph, you're a principal of a girls' school, or Monica, you're a principal of a girls' school. And the question was, in your thoughts, if an adolescent or a teenager is pregnant and in school, would you advise an abortion, or would you, or what would be your take? Should they keep it, or should you abort? Now I've given you titles. In this case, maybe assume you are in the shoe of a principal of a girls' school. What would you advise? Now Ivy, what would you advise?
Okay, so the best thing in that scenario is to allow the student to study and then offer some counseling services so that they are able to cope and continue learning. And then now in advanced stages of the pregnancy, they can go home, give birth and everything. And then once it's sorted, they can come back and learn with the rest. Because we don't have to put our lives on hold just because of pregnancy. There's life after that. So these teenage girls can be encouraged to go home and come back afterwards and then resume their studies. So they should not be shunned off because dropping out would also result in other problems. They may get the second child on and lead to other problems. And then allow me to respond to your previous question about the anemic child. So what normally happens in these special facilities, like Mary Stopes, I've done my research. What happens is that these ladies are tested. So any complications that they have, they're normally taken note of. So even when they're given the medicine, the doctor is able to know the outcome of that medicine. So the likelihood of having complications are rare. Those who get complications are those who resort to traditional aspects or seeing a quack. That is where these complications come from. So we should really advocate for girls to go to, safe and good facilities so that they get help.
Thank you so much. There's a listener by the name of a 1.5. I see you requested to speak. If you so, you have a minute to air what you wanted to say, please.
Hello, my name is Kiptanui and would like to give an opinion of what if I was a principal in a school where a girl gets pregnant. For me, as a doctor in the making, I believe that pregnancy is a physiological process and it's a natural process, but should not hinder someone's normal daily activity. And when pregnancy hinders normal activity, it now becomes somewhat of a at the back end, the pathology which should be addressed so that the pregnancy continues without hindering someone's life. So for me, pregnancy should not in any way hinder a girl's education, like should not keep a girl out of school. And as a principal, maybe it would be to address the issues of stigma amongst girls, amongst the fellow students towards them. But I strongly believe that pregnancy at any age that is not below 18 for a country is not a high risk in any way should be treated as a normal and natural process in a human's life. A woman has a role in, apart from the gender, there is the sexual aspect of it, which is they have something we'd rather call a reproductive career, and a reproductive career of their own choice, which becomes legal and of their own choice starting from the age of 18. And not any other thing, not even education, should really be something, as long as it's out of their own will and they are ready to do along with it. I think it's good to let her be, and let her be in school like any other being, because pregnancy is natural and physiological. Thank you.
Okay, thank you so much for that. Yes, I was asking. I need to know, Kish, Stephanie, if you are principal and one of your kids is pregnant, what would you do?
Yeah, so if I was a principal, first thing is the fact that the adolescent girl has approached us to inform us that she's pregnant. I think the first thing is to first sit with her and just give her a listening ear and listen to what are her thoughts. What is she feeling? She's the one who's pregnant. So is she stressed? Does she want to have an abortion, or does she want to keep the child? So that will be the first thing. I'll first engage with the girl to get her thoughts. So for me, the situation can go both way. So if she doesn't want to keep the child, we will opt for an abortion. So we will take her through process of counseling, because even when you go to marriage stops, there's pre-counseling and post-counseling before the abortion process. And also, if she wants to keep the baby, we will just allow the girl to go home, stay with first get pregnant, give birth, and then she will join school later on. So two situations.
Thank you so much. Effie, if you are principal, what will you do?
I think first it would be to sit down with the students and let them know what they are facing, what are the consequences, what are the stakes, what is at stake actually. Because the students mostly they don't know what they're doing. They maybe it's because they are going with peer pressure or something like that. And also add if they are okay with it, we'd inform the parents or the guardians and people who actually are there for the good of the student, because these people can actually see it in an angle that the student cannot see. And it's actually the student's decision if they're keeping the baby. Though I'm actually against the abortion side of it, because uh, no one can really tell who the baby will become, or if there will be consequences that they did not see before the abortion. Yeah. So I'd actually tell them to sit down and take some time to look at the situation from every angle, because a lot of times in these situations everyone rushes to make a decision, and that's where the problem starts. So I'd advise them to think about it for a while first before making a decision, because any way they decide to go, it's already life changing. If they decide to keep it, it comes with a lot of responsibility, a lot of compromise, and a lot of decision making that they are not used to as teenagers, that they are not ready for as teenagers. So, and if they decide to get rid of the baby, there is also there are complications. They might regret it. There are also very many there are also very many consequences that they might not have seen. Yeah.
Thank you so much. I see somebody has requested to speak. Melody. What you have a minute to say? Maybe to put up your point. I saw your request to speak.
Hello everyone, I'm Melody. I personally had and seen such a situations when I was in high school, we had such a lady who was from Samburu, and due to the raids that are normal there, the tribal raids, she got pregnant. And so what I saw our deputy and the parent talk and decided that it was best for the girl to have an abortion. So I think for it's required in some circumstances because the girl was facing a lot of stigma. We were finishing our Form 4 exams, and it was too much for the girl. For me, I think they did. The decision was best for her.
Thank you so much for that. I'm leaving one person out. Monica Marvel. If you're a principal, what would you do?
Okay, so what I'll do is, like they've all said, talk to this girl, and mostly, because maybe I will not be that have that knowledge of maybe counseling or what. So I'll refer to a counselor, someone who can advise and give her the options of abortion or keeping the pregnancy. So maybe I'm also supporting keeping the pregnancy. So what I'll do is just about the stigma. So counseling the girl to accept the situation and to be able to face the stigma at home, because maybe there's at home and that there is that at school. And also is educating the school about that, not to make that girl feel maybe not wanted or something. Because I also had a classmate when I was in Form 4. She was pregnant, but we just knew she was pregnant as a class. No teacher told us about it. So people were just talking, and maybe she could hear. So maybe they need to educate the classmates about it to accept her. Yeah. So I'll say that. Thank you.
Okay, as box girls, that is Stephanie. Can you hear me? Okay, I think they have a technical issue. Let me confirm with a neutral person. I think Ivy, can you hear me?
Yes, I can.
Okay, thank you. And the next issue is the issue of we've discussed the thought of if we've taken ourselves to the shoe of being a teacher or being because these ones are teenagers and they are going to school, so we had to put that one also into consideration. Now, the next question, what could be the reason why teenagers are resorting to contraceptives to evade pregnancy? Remember, the conversation was the case of rising teenage pregnancies and contraceptives use. So a while ago, while we were having another Twitter space, I asked, why do parents now, just because have a young, a 14-year-old, a 13-year-old, a 15-year-old, a Form 2, Form 3, Form 4, Class 8 child, or a Class 8 lady, or a Class 8 girl that now appears amekuwa mkubwa sana, so kukua mkubwa meaning she has grown, she is fat, or maybe she's healthy, let me use that term, and she appears womanly, or she appears like a woman. So the parent fear that the image, hata huyu mtoto akitembea kule nje watu wanaweza fikiria maybe ni mama ama maybe ni msichana mkubwa. Sasa wanaume waanze kumuita, na yet ni mkubwa tu hivyo, na ako tu class 8, ako na mwili kubwa na ako tu form 1. So this, whatever these parents choose to do, they decide to take the lady, because at this point the child lives with the mom and the dad in the house, so she has no opportunity to make a decision. So the parents decide to take this lady to family planning, contraceptive use. So they advise the child and they take the child to family planning. So just with the fear of, now because my child appears so big in body, she's at risk to get pregnant. So the question is, what could be with also in response to what I've just said, what could be, because I think at this point we need to be more realistic. Hizi ni vitu ambazo zinafanyika and we cannot turn a blind eye to this. Because I've also experienced that, because mzazi anaona mtoto ako form 1 na anakaa mama kwa sababu ya mwili yake, so anaona is at high risk, let me take this child to family planning. Anaekewa, anadungwa shindano ya miaka 4 ama shindano ya miaka 2, ama anaekewa zile zinaitwa, I don't know what they are called, the coils or whatever, so that she doesn't get pregnant. And that one sounds so selfish. But now the question is, what could be the reason why teenagers are resorting to contraceptives to evade pregnancy? And to what extent are they aware of the dangers of the contraceptives? And even if to what extent they are aware, do they even know the danger? So I need a response with regards to why they are resorting to contraceptive use with the support of the parents. Some parents are really pushing that so hard. And I realized one day we went to a certain meeting in a certain high school, and the parents were like, the kids wanafaa kuleta madaktari hospitali wapatie watoto family planning juu watoto wanapata mimba. Unaona, so that sounds so selfish. But now why do you think they resort to contraceptive? Is there any other way that they can be talked to? Do you believe the older ways that were being used, like parents could put you down, wakuongeleshe baba yako na mama, wakwambie mama, you need to do this, and you listen to that and you follow instruction? Do you think the world or the country or the adolescent of this age have outgrown that? They are not people who we can sit with down and talk to and expect them to listen, to a tune of us subjecting them to forced contraceptive use. Or maybe in a case, there's cases where a form 2 decides to go for contraceptive use by themselves, wanajipeleka, anasema yeye amemaliza shule anataka kuenda family planning. So how can we advocate this? Let me seek the indulgence of this point. Ivy, you'll go first. You'll have a minute to respond to that. And Steph, you'll have a minute to respond to that. And Effie, you'll have a minute to respond to that. Or Joel, a minute to respond to that. Monica, a minute to respond to that. And Melody, now the new guest, the new speaker, to respond to that. So Ivy, you have your 1 minute. The floor is yours.
Okay, thank you. So you find that parents put their kids on contraceptives because they are afraid that their worst fears may come to pass, that their kids may get pregnant. And parents are afraid of addressing the elephant in the room. So instead of them advising and working with their children, they just take the child to the doctor, a 4 years injection, and it's over. Like they're looking for a preventative measure. So what should happen is that these parents should work with the child from the onset of teenagehood. At 11 years, they should be telling them bits by bits, giving them this kind of information so that the child knows what to expect. So part of what is to blame is the family structure. Nowadays, you don't have parents sitting down telling you this and this, don't do this. And so we find that that value system and that guidance is quite missing in the family. So it starts from there. And a parent putting a child on forced contraception is very wrong. And it is something that we should really advocate against. So the solution is to the parents should guide their kids on what to do. And then why teenagers opt for contraception? It's because it is something that is discreet, They believe that no one will know, and then they think it's a quick fix, you know. And so, like, a high percentage of teens are opting for that because they're afraid of pregnancy more than they're afraid of contracting STIs and HIV. So that is what happens. And they have very little knowledge of the effects of contraception because right now you see something like P2, it is very common. And the effects of these contraceptives is that they later in life you may have uterine complications. They also get irregular menstrual bleeding and other issues. So the teenagers are not really aware of these side effects, and that's why they opt for the contraceptives. Thank you.
Thank you so much for that input. Steph, you go next.
Thank you. So I'd say for me, for a teenager who's using contraceptive, it's actually an informed teenager. That's someone who has knowledge on sexual reproductive health and rights. Because when you talk of contraceptives, even a condom is one use of contraceptives. So for me, I don't know about the risks of using contraceptive, but Ivy has said in the long run. But I think in every medication, when you use something in excess, it's when it's going to bring in complications. So for me, my thoughts is that a teenager who's resorting to contraceptive to evade pregnancy is actually an informed teenager. And for to what percentage are they aware of the dangers? As I said earlier, I've not heard of any dangers of using contraceptives, unless just like any drug, it is overdosed. Yeah.
Thank you so much for that. And now the people who are going to respond to that next. Stephanie has said she has never had any like any effect of using contraceptives. So maybe you can also factor in that, if as you're going to speak next, if you have ever had any effect to contraceptive use, and Monica and Melody and Joel as you're going to speak. So Effie, the floor is yours.
Thank you, Joshua. So first, I'd like to say that there are a lot of teenagers who tend to bloom earlier than the rest. Yeah, they exist, and it's actually the society is actually pitched against them. So I get the point that parents can actually be concerned because the society can be evil. People can tend to take advantage of these early bloomers because they look like grown-ups but they're not grown-ups. So I get the point that parents can be concerned, but then again, you might find that uh, a teenager may not actually be involved in sexual activities per se, but then the parents goes and gets them on contraceptives, and then the problem starts there because they'll start questioning, why do I actually need contraceptives when I'm not doing anything wrong? And they'll actually take it as a leeway to start doing the to start engaging in premarital sex. And this one can actually have effects because most of these contraceptives, some of them are actually hormonal, and when it's hormonal, it actually affects teenagers' bodies differently. I'd assume we're talking about teenage girls. Hormonal contraceptives actually affect their bodies differently, and it can actually interfere with their menstrual cycle. It can actually make them gain weight or things like that, which actually tend to affect the teenagers themselves. And I think it's a practice that we shouldn't actually stand for, because parents should not be doing that to their children. What they should focus on is telling their children what is going on in the society and why they shouldn't be following the bandwagon, instead of actually taking them to clinics to get them on contraceptives. And I'm not sure about the laws, the law of Kenya and how it views this, but personally, to me, I don't stand for it because everyone is entitled to their body, and below 18, they're actually not in a position to make the right decision about that. So the focus should be on making them aware of what is going on in the society instead of actually make getting them on contraceptives. It's like killing a mosquito with a grenade. Yeah, it's overkill basically. Thank you.
Thank you so much. Oh no, Marvel, Monica, the floor is yours.
Okay, so my take on this is okay, we started with saying this high teenage pregnancy, and then we went to abortion, and now we are in the contraceptive. So there's we can't lie, there's high teenage pregnancy. It's on the rise. So it's either abortion or using contraceptives. So personally, I also think it's the decision of that teenager to decide whatever she wants. So all I'll say again is I work with the girls from rural areas, and I won't lie, so many girls are sexually active. So how do you deal with that? So if we don't use contraceptives, we will have to deal with teenage pregnancy. So I don't know. There's no balance in that. There's no balance in that. So it's just the decision of that child, and then with the information. The only information that we should pass again is the that contraceptives just prevent pregnancy and not STIs or HIV. Yeah, and a lot of now advocacy, a lot of advocacy on SRHR is now focused. There's addition of the use of contraceptives. So even I've attended some advocacies. So where advocating where the peers advise these girls. So there's the mention of contraceptives and the effects of these contraceptives. I wouldn't say know the effects apart from menstruation, maybe irregular menstruation, or it affects the menstrual flow. Yeah, that's all I know about the effect. So maybe if we hear from others about the effect, I'll again say it's the decision of that person. If you don't deal with the, if you want to deal with the contraceptive, meaning their abortion, their contraceptive will have to deal with abortion or teenage pregnancy. So which one? I don't know. We cannot choose whatever to deal with. I don't know. Yeah, thank you. That's my take.
Thank you so much for that. Um, Melody, can you add on something about that?
Yeah, thank you. I would say it's good for the teenagers to know about the contraceptives and know about all the methods that they can prevent themselves. But on the same issue, we tend to overlook the mental health of the teenagers. Some of them maybe they struggle with their education, they got family conflicts. They are humans who experience other emotions than sexual emotions, and the a lot people in the society tend to overlook such issues because all they give is maybe advice on contraceptives and changes of the body, but the mental health of a teenager is very much forgotten. So I would say as much as they as as long as much as they sexual education though, they should also look at the mental health of a teenager.
Thank you so much, Melody, for that input. Joel, you have a minute.
Thanks once again. Actually, let me begin with reiterating on some issues based on the instance you've given, like of a girl who just bloomed early before when it's not her right time to bloom in accordance to the parent. Actually, I want to say this is a lack of acceptance from the parent side, and when a parent doesn't accept your body shape and starts advising a young girl to go for contraceptives, this is like a doctor, like when you are when you've consumed, allow me use this instance, when you've consumed contaminated food and you've got some stomach upset, and boom, the diarrhea comes in, and when you go to the hospital, the doctor tells you that you need to tighten your bottom opening so that you don't diarrhea anymore. This is the instance that these parents are bringing on board. Actually, what I would advise parents to do in that situation, to normalize sexual talks. Don't just rush to the end result. Please begin from the bottom. You can't just come to build the roof where you'd never built a foundation. On to the question, I would say that teenagers resort to contraceptive to prevent pregnancy, a situation which is very sad over them because there are so many other things that come with unprotected sex. Uh, those STIs, STDs, and majorly I blame society at large because the focus is on the pregnancy alone. Actually, this tells us that we want to live a plastic life whereby people from outside see us as good, but within the inside, we are like a wolf on sheep's skin. And on to the next one, talking about dangers, I would say that some know and some don't know. Unfortunately, those who don't know are the people who are making it quick to go to hospitals and health facility requesting for the same. And for those who know the dangers, actually, what they normally do is the bottom line, abstain. They normally abstain because they know the repercussions of the same. And on the dangers, you see that as had been mentioned earlier on, these stuffs are not that dangerous, but the consistency in using the prolonged usage brings about some dangers like the blood clot. E.g., the diseases like the thrombosis and yeah, such kind of stuffs. And these ones may bring all along towards the old age times, whereby you find that some people have got these weird complication that no one knows where they came from. It starts with where we started from. The usage, prolonged usage, and do we know how to use them? Do we know when to use them? On what is the appropriate time to use them? Thank you.
Thank you so much. I think Melody had brought a very key issue, that is the issue with regards to the mental health, and yeah, that is more sensible. But now we have spoke about the contraceptive thing. We have something we call the emergency contraceptive, that is the P2, and most of the adolescents and teenagers they don't have adequate information on the, I think, on the meaning of the word emergency. And here is where you get a case where um, teenagers indulge in sex, a form 3 and another boy in form 4, or a form 2 and a form 4, or a teenager with an old man, somebody who has graduated in campus, or maybe somebody who is big, because they, whatever they, after finishing what they are doing, this guy will dash out a P2. Okay, and now it will be consistent. They will take a P2 today, and then the next time they meet, they also take a P2. They also take a P2, like that, like that, like that. Personally, from my own way of knowing, or the know I have, and it's an I want to know question. Um, Somebody once told me that there are these emergency contraceptives. The case of I will say it the way they were saying it, ati P2 imefanya nini? P2 backfire, or P2 ijakuwa effective. And also there are companies that produce the emergency contraceptives. I won't say they are ineffective, but I don't know. So where in a case where people don't use the long time contraceptive, they use the emergency contraceptive. I think for me, emergency should be an emergency thing. Like maybe if you are raped and then you take an emergency contraceptive, or for big people. But now youths and adolescents have taken it to their own perspective to use P2, and then sometimes you get somebody used to P2, they start what do we call it, blaming each other. Si nilikupatia P2, mbona umeshika mimba? So you know something. So do you have a thing like P2 kufanya nini, kubackfire, kutofanya kazi, or is it the consistency of using that emergency contraceptive, or is it a reception of the personal genetic modification that at some point it decides, no, this thing is not going to work here anymore? So I'll sought the indulgence of Stephanie, please, if you can give maybe something about the same. Okay.
Uh, Sorry. So I'm having network issues. Could you go again?
Okay. What I'm saying, let me repeat myself. We have emergency contraceptives, the P2, and so I think people have become so much ignorant where they don't even pay attention. That thing is, it's an emergency thing. So most adolescents who indulge in boy girl relationships, I will call them that because that is what they are. They have had a knowledge of P2. So kijana anafanya kile ambacho anafanya, ananunua P2 anampatia. So and then at some point you'll get, at some point it must reach a point where things don't go the correct way. Sasa unapata hapo ndio there is lawama, like we had sex with you and I bought your P2. How comes you're pregnant? So what I want to know is there a case, or is there something like the case of the emergency contraceptive not working, or is it a genetical response that your genes respond after too much consumption of the emergency contraceptive, now it doesn't work, or what is the explanation behind that, if it does exist?
Oh, okay.
uh, I think Steph, we can't hear you. I think you have some technical issue, you're not audible. Ivy, do you have anything on response to what I've asked, please?
Yes, I do. So the first
Okay.
reason why the emergency contraception fails is when it is taken after ovulation has occurred. So it makes it ineffective because P2 works by delaying ovulation. So when it is taken after, then it becomes ineffective. That is the main reason. Another thing is timing. When it is taken within the first 24 hours, it is 95% effective. But when it's taken between 48 and 72 hours, it declines to 58% of effectiveness. So basically, those are the main issues. And then another thing also is like the frequency. You find a person is using it over and over again within the same circle. So that effectiveness is reduced. It should be like the doctors recommend that it should be used within only twice in a year, but people misuse it.
Thank you so much for that input. Marvel, do you have anything to in response to just what I've just asked? Marvel, can you hear me?
Oh, yes, I can hear you, but honestly, I don't have the answer. Also
Okay,
listening.
thank you. Effie, do you have anything to say over the same? Okay. Melody, you have anything to say over what I've just asked, please?
I don't have anything. Sorry.
Okay, thank you so much. Okay, we'll allow me to, because of the haste of time, let me move to the next issue. We have as I was starting, we have something we call triple ending triple threat campaign by the government, the National AIDS Council, and the National Commission on Population. It was adopted by the two state corporations. So they brought this up. It has three pillars. That is, one, it has a pillar on HIV AIDS, combating HIV AIDS, teenage pregnancy, and SGBV. So the key question is how efficient for those. I think let me assume, like, at least all of us have come to this term, ending triple threat, and if not, maybe you'll get your time to go to the website, AIDS National AIDS Council, to see what ending triple threat is all about. But for those who have an idea over the same, how efficient do you think? Let's give ourselves a 1 year time from the time it was intercepted in September. Let's say, do we expect by September next year, a 1 year round, that we'll have advocated, that will have achieved success, the government will have achieved success, and the input by individuals, just like what we are doing, the NGOs and the community organizations, would we have achieved efficiency in at least advocating for the three issues under the Ending Triple Threat campaign? That is, an end to teenage pregnancies, an end to uh, high rise in HIV infection, and a decrease in cases of, not a decrease, a zero tolerance to cases of sexual and gender-based violence. So the question is, do you think if we give ourselves a range of 1 year, let's say from it was intercepted in September, now we take until September of next year, by your own thought and in your own seeing, do you think will be at least we expect better results? Do we expect better things? Do you expect a change, or do you see things will be worsened, or maybe you don't know? It's also that option. So this one I can't say for I'm just restricted to those who have knowledge over the same. So let me request, if you have a response to this the same and triple threat campaign, and you have something to say with regards to its efficiency in the next 1 year, you can just unmute and speak, please. Anyone who has a response to ending triple threat campaign by the government? Okay.
Okay, so I think I'll go first.
All right.
So for the campaign, the good thing about it is that it is national. So it was it came from the national government, and then now it was devolved to the counties. So I saw one of the programs has been launched in Murang'a County. So you find that since it is a county, it is more devolved, like it is more in the grassroots areas. And then the NGOs in that county are able to so that they're able to identify these problems, the new HIV infections, because I realized that there are about 5,000 HIV new infections. There were 5,000 HIV infections in 2021. That is from adolescents between 10 and 19 years. So, yeah, I think by the end of 1 year, we'll have seen changes because this one is a new style. We are seeing that the local government is engaging with NGOs to end this.
Thank you so much. Any other person who has an input to the ending triple threat campaign and its effectiveness in the next 1 year? Maybe an addition to whatever Ivy have said. Okay. Let me assume all of us are okay. Okay, so that was the efficiency of ending triple threat campaign adopted by. The question was, how efficient do you think the end triple threat adopted by various stakeholders of the government is going to be, and should we expect a change in the key issues advocated for by the campaign? And we have had a response from one, um, Ivy, who is also a journalist in the upcoming. So she has said that we expect change because it's a devolved thing in a county level, and we look up to that. We are still here. 2023 will still find us here. So the next thing, as an individual, as an activist, because all of us will say we are activists, that is why we are in this conversation. At an individual level, at an activist level, at an organization level, that is Box Girls Kenya, at a community based organization level, what is the role now that we know we have had this conversation? What do you think is your role as an individual? It's not about putting things on paper and talking them emptily like that, but at least you have a role. So as an individual, what do you think is your role in advocacy to the rising cases of teenage pregnancies and contraceptive use? What do you think you can do so that together with the government and the National AIDS Council Commission, we can say, I joined effort, and we are at this together? So maybe let me say, Steph, do you have, maybe Steph, what is your role as Box Girls Kenya? And yeah, exactly.
Yes, so I'm sorry. So I've had network issues. So I hope you got me the first time. The other question you'd asked before I reply this one
No, we
on.
were not able. We were not able to hear you. So you can just match them up, please.
Okay, kindly allow me to match them up. So, on the issue of being pregnant after using a contraceptive, I was explaining that you might find the only cases I've heard about someone getting pregnant after taking an emergency pill is when they delayed in taking the pill. So, it's supposed to be taken within 72 hours. So, I've had two people getting pregnant after taking the pill just because they delayed. Maybe they took it after 3 days, or they took it even on the third day. Yeah. So that's my take. I hope you've had me.
Yeah, sure. We have heard you.
Okay. So on the next issue of what as an organization we are doing, or what we will do. So I think I'll speak on what we are doing because we are definitely working with girls. So SRHR matters is one of our concerns. So we've recently launched a sexual reproductive health and rights curriculum, which was informed by the babe.
We've lost you. We can't hear you. Can't hear what you're saying. I don't know. I think he has a technical problem. And Ivy, what's your role as an individual?
Okay, so my role here is to create awareness on sexual and reproductive health rights, ladies, especially the younger ones in schools, primary and secondary levels as well, and also educate those in the community, that is our parents as well, so that they're able to understand some of these problems. Collectively, our role can be coming up with policies, suggesting policies to the government that can be used to, to reduce the rates of teenage pregnancies that we see, also SGBV, and the role of NGOs can be to come up with campaigns that is in the grassroots areas. That's it from me.
Thank you so much. Let me go to Effie. What's your role as an individual?
Thank you. As an individual, I try to raise awareness and to, there are people who are actually on the ground actively trying to combat teenage pregnancies and contraceptive use among the teenagers. So my role as a person is to try and contribute to their efforts and to actually help them to get the message out there, because we have to work together if you're going to fight against teenage pregnancy as a society. So my role as an individual is to actually help them to contribute. Yeah.
Thank you so much for that. Marvel, what's your role as an individual?
Yeah, so as an individual, obviously, I can't work alone, so I'll join efforts with the already existing work that is currently ongoing. So mostly it's just SRHR advocacy, capacity building these young girls and boys, yeah, young girls and boys, and also incorporating entrepreneurship into the decision. Thank you.
Thank you so much for that. And now to the last issue. I think this one will be more important. The last issue was, what is the role of media? We've seen so many media stations in Kenya bringing to our limelight the issues of teenage pregnancy, SGBV, rise in HIV infection, mental health issues, and what is the role? And this one goes to Ivy in specific. So, what is the role of media in advocacy, apart from just airing the stories to us and leaving us to that to just watch and what do you think? What extra thing do you think the media should do so that to achieve advocacy? Yeah, as a journalist, this now.
Okay, thank you for the question. The first thing is that media, the media can be both a platform and a partner in this case. A partner in that, like you find Royal Media Services, someone can partner with them to carry out this kind of campaigns. You find that Royal Media Services has creatives, who work there, like Jeff Koinange and the rest. So these people can go to the community, speak about these issues that we have. So that is partnering with the media. So as a platform, we can use the media to generate awareness. NGOs like this My Hope community can be able to take their content to the media so that they can be able to raise awareness on an issue. Another thing is that media can motivate people to action. If there is increase in teenage pregnancies, whenever the media shares the statistics and calls people to action, you find that there's a lot of uproar and people actually get to act on it. Another major thing is funding. We can use the media to get funding for some of these activities. Like when we have, let's say, a community outreach somewhere, we can be able to use media, that is mainstream, and also digital media to be able to get funding, resources in terms of like people who can join us in such kind of outreach programs. Another major role, I think it's advancing public policy initiatives. Like if an NGO or an individual has something they want to table, they can be able to bring it forward through the media. Whenever there's an outcry of something, maybe a sexual violation, and it comes to the media, you find that issue is resolved very fast and we are able to see changes. So for me, I'll say the media is a powerful platform, but even as we rely on the mainstream media like TV, we should also focus on the digital platforms, our own social medias like Facebook, Instagram. We should use those platforms to advance some of these advocacy issues.
Thank you so much. I've seen a request for somebody to say something. With the haste of time, if you really have something to say, I'll give you a minute to say what you wanted to say. This speaker called Colmira. If you have anything to say, you have a minute to put it across. Kindly.
So hey Joshua, it's Stephanie. I'm really sorry I left the meeting. I'm having a big problem with network. So I just picked the phone of someone to speak. Am I allowed?
Yeah, okay, okay, yeah, sure.
Okay, so I wanted to speak on the role of CBOs and CSOs. So, for us as an organization, we recently launched a sexual reproductive health and rights curriculum that was informed with the high rise of pregnancies and lack of access to information. Yeah, so I think that's one major achievement we've done this year. And the book will actually roll out to other CSOs. They can purchase it and use it. So I think that's one thing we're really, really doing in terms of advocacy on high pregnancy amongst teens. And for the role of the media at large in advocacy, I think what CSOs should be doing is we need to maximize the reach of some of our networks, like some of our media houses. So for us as an organization, what we always do, we always just, I realize that the media houses are really, really interested in advocating for girls' right, because when you just give them a phone call, they always come and feature your story and it's actually aired. Like I'd use us as an example. We've this year we've had almost 10 media tours, and we've had almost I think 15 radio talk shows, because we are trying to maximize their reach in advocating for girls' rights and everything. Yeah.
Thank you so much. Let me okay. So we've had on the issue of media and the role of media, and also we've exhausted on whatever we were discussing. And I'll just request one of us before I wind up with the haste of time. I think it's always good to, if you have a guest, it's always good to give your guest an opportunity to say a word and regarding the conversation, or regarding what, or regarding you as a host. So let me take this opportunity to give uh, Ivy an opportunity, Ivy and Effie respectively, at least to say a word with regards to the space we have had today. Yeah, if Ivy will go first, maybe.
Okay, thank you, Joshua, for this. So I'd like to say that I'm grateful for this platform. I think us coming to share ideas and seeing the way forward, it's a good thing. So we're grateful for this space. And also, you've talked about having like more sessions in order to advance some of these issues. So I think it's a good thing. And I'm looking forward to more of the sessions. But one thing I really hope is that we reach more people. So let us kindly share what we're doing here on other platforms as well, so that we're able to have more impact, even as we look to continue. Yeah.
Thank you so much. And I, Joel, could you give maybe an insight to what we have just talked about? Maybe we'll call it. People call it a vote of thanks. Maybe. So I don't know if you have any, or you have something to say. Okay. Okay. Um, I lost Effie. So Joel, I can you be able to hear me? Steph. Okay. What will you say? What will be your last remarks to this conversation? Now that you've signed in with another name.
Um, so this was really informative. I'd say one thing I learned is about the N triple threat. I had not really familiarized myself with the thing, but now I am well aware, and I think I'll do more research. So one of my recommendation will be just like Ivy, but in a different directions. So when we have the next, since you've spoken about us having more of these spaces, I think we keep retweeting and informing the rest who will maybe join in tomorrow, or they forgot about this, so that they may check on all our social media pages. So we just retweet on a certain conversation. We pick a certain conversation, retweet it and tag maybe everyone who is in the space. And if you are tagged, maybe retweet it so that it can get to a wider reach. Yeah. But thank you so much for the opportunity. I represented my organization well, and I'm really, really looking forward to more.
Thank you so much. If I had lost you, maybe you'd finish it up. Maybe whatever you wanted to say, if you can hear me.
Thank you for the opportunity. It's been a very interactive session. I've learned a lot. Thank you to my fellow speakers. And thank you, Joshua. Thank you for this opportunity. So, what we can do from now is to mostly create awareness, and because there are also people out there who are trying to shed a light on these cases of teenage pregnancies. We can support, we can tweet, you can post, we can share, we can do everything to make sure that they're actually being heard and they're actually being seen, because the goal is to reach that one teenager, that someone who does that somewhere, and they don't know that they have their options out here. So the goal is to make sure they get the message, and also to support the stakeholders who are actually trying to do something currently. We can tweet, we can tag every other speaker in the chat, and we can make sure that the message is amplified so it reaches as many people as it can reach. Yeah, thank you.
Thank you so much. Now that we had a new guest, Marvel, Monica, could you have anything to say even as we finish? Okay. Think maybe I don't know if she can hear me, but it's okay. So, and Joel, can you hear me? Maybe.
You called me.
Yeah, sure. Yeah, I just wanted you to give maybe your thoughts over the conversation. What we normally call maybe a vote of thanks. I don't know.
Okay. I'm so grateful for this chance. I know I was not a guest speaker today, but anyway, uh, it's for the information, and I've gained a lot also, being that we work in different communities, the different perspective of whatever we are currently uh, having for communities. We've been able to share and we've learned a lot. So thank you so much, and I'm looking forward to more conversations.
Let me just take this and then enumerate something just as we finish up. We this was we are working with regards to the End Triple Threat campaign. And so I said it is pillared on three things: the rising cases of teenage pregnancies and HIV/AIDS, and also SGBV. So this one was just season one of the conversation. So we'll have season one, episode one. That is, this is the first episode of that ending triple threat campaign. So I know I have contacts to Effie, Ivy, and Steph, and Joel, and so we'll be having another conversation over the same on sexual and gender-based violence. So for those who have listened to the space and would like to maybe take part as speakers, maybe you can drop your number at the messaging board of the Twitter account of the organization. So for those who have gotten to communicate with Effie, Ivy, and and Steph from Box Girls, and any other speaker we had today, I'll engage you. And at the end of the day, we'll have certificates from National Aid Council Commission. I'm working on that so that you are legally recognized as an advocate for the End Triple Threat campaign. So thank you so much for taking your time more than, I think, more than almost to a tune of 2 hours of talking and answering questions for the sake of us with an impact or with a target to help out here. Personally, I've learned a lot, and as an organization, also, I'll give a very good review of the Twitter space and the talk we had today. And from an individual perspective, it was so good, and I applaud you for that maximum participation I got from you. So just thank you so much. I'll send emails and details of the SGBV Twitter space we are having in the next 2 weeks to your accounts, to your WhatsApp. For those who would want to be part of the speakers for the upcoming SGBV campaign, just drop your number so that I have it, so that I contact you and send you the details. So I think thank you so much. Na kwa wale ambao the Twitter space was being recorded, if you would want to have it, maybe you'll send me a request so that I send it to you. There are people who would be asked maybe or would want to have a documentation of whatever thing they did uh,
By the
for
way, is
some
the
time.
side getting anything or it's all of us? Just a question it is.
Ivy, can you hear me? Okay, let me, Effie, can you hear me?
Yeah, I can hear you.
Okay, and okay, thank you. And Monica, Marvel, can you hear me? Because somebody is saying they can't hear me. Steph, unaweza kunipata? Unanisikia kile ambacho nasema?
Yeah, I can get you clearly.
Thank you so much. Joel, I think you have a very network issue. So just the same way I was saying, for those who want to be speakers for the next episode of Ending Triple Threat campaign, you'll just, wale ambao sina namba yao ama sina emails zao, kindly just drop at the messaging board of the Twitter space.
Is the talk still on?
Yeah, sure. And so sasa wale ambao wangependelea kukuwa wageni and to speak in addition to my current guests, I'll be so much privileged to indulge, because this one is a unified approach, and it will be more better if we join hands, because when we come together, great things happen. I think this talk was not only on Twitter, but the impact and whatever we've talked about will emulate it, and we'll put it back to the grassroots where we come from. Asanteni sana, and as we say at Raise My Hope, what we do, we serve with love, and above all, being that we are founded on Christian principles, kila ambacho mtaniruhusu kusema ni I thank you so much for taking part in this, and I wish you a good night and a peaceful night, and may God bless you. And in future conversation, the future endeavors will work together. I hope to see you, and I hope to get your indulgence of the same. So may God bless you so much. I don't take it for granted. I don't take it for granted, because somebody spending almost 2 hours of their time to listen and to contribute, it doesn't go in vain. So I'm so much humble. So thank you so much. Thank you, Ivy. Thank you, Effie. Thank you, Marvel. Thank you, Steph. Thank you, Joel. Thank you, all the listeners, Sharon, Lugasi, Asena, and every other person you tune in to this live. Mungu awabariki sana. Asanteni sana. Thank you so much. And have a good night, all.
Good night.
Okay.